So today we'll be exploring the topic of whether life without pain would actually be an advantage. Like the show Mythbusters, we will either prove or bust this myth by the end of this presentation. Let's first explore this myth's origins.
We believe this myth most likely originated from those who want to experience an event without feeling the pain it may come with. In general, most people would think life without pain would be better. I even asked a family member for their take on pain. Our source said, "I usually associate pain with negativity, so in a way it would be nice to have a bit less negativity in life." This can be a common answer for most people, but there's more factors to it.
So now that we've delved into where this myth originates, we need to explain some concepts before we prove or debunk this myth. So, what is pain?
Starting with the biological approach, pain is your body's signal that something is wrong. It draws your attention to the tissue damaged by a burn, break, or sprain so that you don't repeat that damaging behavior. This idea is best demonstrated by the gate control theory, which suggests that our sensory nerves detect tissue damage, thus signaling a gate in our spinal cord to open, allowing us to feel pain. For example, in this picture, the person touched a burning candle, which prompted their sensory nerves to open their spinal cord's gate for pain, initiating their response to withdraw their hand and not burn it. From a sociological perspective, we may perceive our own pain more if others around us are also expressing pain. Additionally, when we empathize for others, our brain mirrors their pain, resulting in us expressing pain that is not directly ours. From a psychological perspective, one could say that our perception of pain is subject to how much attention we give to it, such as an athlete continuing to play despite being injured. Also, our memories of pain tend to be based on when we last felt it and when we felt it the most. Moving on from the biopsychosocial model, we must look at the working memory model, which suggests that we create memories by receiving, encoding, and storing sensory information for it to be retrieved later. Relating this to the biopsychosocial model, our sensory input includes the actual pain we felt and our perceived pain. This sensory input is then encoded and stored as memories. Someone who could feel pain could retrieve that memory and remember not to repeat the damaging behavior, such as putting their hand on a flame. However, someone who couldn't feel pain would be missing that sensory input, which they couldn't encode or store. While they may remember the perceived pain if others are around them, this could pose a problem when they're alone and they don't have that biological signal. This could lead to them unconsciously repeating the same damaging behavior.
CIP and CIPA are both genetic diseases that affect how people feel pain, or don't in this case. CIP is congenital insensitivity to pain, which is a mutation that leads to lack of pain receptors. So for comparison, people with CIP and CIPA are able to feel a sensation or stimulus but don't feel pain, whereas people with congenital indifference, like people with schizophrenia or developmental disorders, are able to feel pain but there's a lack of concern. All other peripheral senses are generally normal with only sensation of pain affected. CIPA is congenital insensitivity to pain and anhidrosis, which is the inability to feel pain and temperature. Because of the inability to feel pain and temperature, people with CIPA are unable to sweat, which can lead to hyperpyrexia, which are high fevers, which then can induce febrile seizures. With CIP and CIPA, there are quite a few concerns. Because of lack of pain, things like fractures can go unnoticed for long periods of time, and they happen frequently, leading to prolonged damage and irregular healing. There are also concerns of developmental delay. For example, there is a study of a girl who had a habit of chewing on her tongue and lips, and because she felt no pain, this led to issues with her mouth and teeth. There are also behavioral concerns. So, for example, many people afflicted with CIP or CIPA often self-harm out of curiosity. There's also a correlation between males with CIP over the age of 20 and certain behaviors fueled by their lack of pain. These behaviors can include risk-taking, picking fights, and involvement in more extreme sports. And while not necessarily a symptom, CIP is linked to things like ADHD, anemia, or anosmia. Anosmia, which is smell blindness, can then lead to affecting an individual's hygiene.
I will be now discussing what is a life without pain actually like. I will be presenting one case study regarding CIPA. This case study will give us an in-depth look into the life of a patient who has this condition. From this study, we will learn why it is not a good thing to not experience pain, since it can be quite dangerous and life-threatening. The case study I will be presenting will be about a child from India who cannot feel the sensation of the environment on their body. This article written by Karunanidhi Udanashankar called Congenital insensitivity to pain and anhidrosis. A case report from South India examined a 5-year-old boy. The boy's family history showed no signs of illnesses, and during his infancy, the patient showed signs of recurring fever. Recurring fever is a symptom of CIPA. It was not until the child was diagnosed with CIPA when the parents found out that their child did not act profusely to the injection of vaccines, physical trauma, and other excruciating stimuli. Udana Shankar also noted that the child had self-inflicted wounds on places like the epidermis, tongue, and phalanges. Moreover, the child did not have an ordinary oral cavity, meaning some of his teeth were missing, and as well as the tip of his tongue. From this case study, it is clear that it is not a good thing to feel pain. Not feeling pain can result in these accidental self-inflicted wounds. Not only can CIPA can lead to these wounds, but it also has its symptoms, which include the recurring fever mentioned in the study. The recurring fever could potentially be hyperpyrexia. It can be dangerous not feeling painful stimuli because the body will not let the individual know if what they're doing is harmful. For example, if someone with CIPA were to step on a sharp needle, pain receptors will not let the individual know that it is a painful stimuli that is hurting their body. In a worst case scenario, the needle stays stuck to the individual's foot and they would not even know it is there, further injuring the wound. Without the sensation of pain, individuals would be greatly and blindly injuring themselves to a point of no return. As a result, the sensation of environmental stimuli helps the body survive in dangerous situations.
With CIPA, someone with that condition must be constantly checking themselves for all kinds of injuries, from as little as bruises and cuts to gashes, open sores, and broken bones. Kids are usually less aware of their bodies and want to live a regular, playful childhood. Because of them being so young, children with congenital insensitivity to pain frequently become hospitalized by all kinds of accidents. They injure themselves repeatedly, and since they can't feel pain, they don't respond or stop what is causing these extensive injuries. One case of evidence, an 8-year-old girl was referred to the pediatric hospital because of fever, severe edema of right leg, inflammation, and purulent discharge from the fistula in both legs, especially right foot. She was mentally retarded and hit her heel onto the ground without any sensation of pain. She did not respond to any painful stimuli or heat shock, but could feel pressure and touch. There were some scars on her skin on different sides of the body, which were, according to her parents, heat scars. Hands and fingers showed signs of biting. Cases like these can lead to prolonged effects in life, whether it be an amputation, scars, or even brain damages. This is hard to maintain and get under control because of the deep infections and high fevers this condition comes with. Other dangers include kids having certain underlying conditions or deteriorating diseases, and they don't feel the symptoms, so it gets worse over time. There weren't many pros of not feeling pain that we could think of. An obvious one was that we wouldn't have to experience painful sensations, which can be a pretty good thing in some events, such as getting a piercing or falling down. Another pro would be having an easier childbirth experience, since a woman wouldn't have to endure the intense pain throughout labor. Now for the cons, there were a bit more. Without feeling pain, it would be harder to diagnose people with certain diseases or illnesses. A lot of them have symptoms of some kind that include feeling some type of pain, and if someone can't feel pain, they'll never really know what's wrong, which can be dangerous. Another con would be that it would be easier to overexert your body during physical activity. One wouldn't be able to feel the pain of doing too much and can damage your body. Along with that goes not being able to recognize serious injuries such as bone fractures or sprains. Also, without feeling pain, medicine wouldn't be able to advance as fast. As an example, scientists use people's pain to develop painkillers, and they test it with their varying pain levels. So without feeling pain, it would be harder to test it and really produce a good medicine. These cons showed us that pain is essential for a lot of our lives and our health.
So, would a life without pain actually be an advantage? Taking everything into consideration, it's safe to say that this myth is busted.